We have been living with COVID for more than 2 years now. In that time, we've seen a number of different surges. And right now, COVID hospitalizations are low, but the cases, they've been trending back up.
Yeah, so what does that mean for summer travel and activities? Our Lauren Edwards has more after speaking with local experts.
The weather is finally nice. Summer is here, and I spoke with health officials, including at Trinity Health behind me, and they said, go ahead, book those summer travel plans. Just remember that COVID is still here.
I think big picture is we're so much better than we were. So I actually want to kind of mix reality with optimism.
And the reality is, COVID is still spreading in West Michigan, says Dr. Andrew Jameson with Trinity Health. However, it's not causing a high number of hospitalizations.
We actually estimate that almost 60% of the population of the United States was infected with Omicron in the end of December, January, and February. So that by itself gives our population just so much antibody.
A mix of the antibodies from Omicron and the vaccinations help fight this latest wave, he says.
The hospitals weren't overwhelmed, which is how we like to keep things. And we didn't see an uptick in patients with COVID ending up in the ICU or on ventilators.
And with school out and the weather getting warmer, Dr. Natasha Bagdasarian with MDHHS says she doesn't expect there to be an uptick over the summer, but people shouldn't completely neglect COVID protocols.
So by and large, when we talk about public health guidance for masking, we've got CDC guidance and they're doing community risk levels. So it's important to take a look at the community risk levels in your county and see where your county is in terms of risk.
This CDC map shows that most counties in West Michigan are green, which means a low risk of getting COVID. But the doctors say be mindful before you travel.
I'm traveling in 2 weeks. Well, I'm not going to be silly before I travel. I'm not going to go eat indoors. I'm not going to go have a party.
He says others should do the same and consider getting vaccinated or boosted if you haven't already.
The recommendation is that everyone over the age of 5 gets 1 booster. And if you are over the age of 50, or if you're over the age of 12 and are immunosuppressed, you get 2 boosters.
But everyone's health is different, she says. So doctors strongly recommend it because come fall, they're expecting cases to go back up. So it's best to be protected now.
The issue is we still have some people that get really sick, and you have to be a good neighbor and a good family member and a good son or a good daughter, and don't put your loved ones who are at risk in a bad spot.
Now, if you get sick for longer than a day, doctors recommend taking a test, whether it be at a lab or it be an at-home test. But regardless, they say the best way to protect yourself against COVID is just to get vaccinated. They are expecting to see an uptick in the fall and winter. Reporting here in Grand Rapids, Lauren Edwards, Fox 17 News.
So here's a quick look at the latest vaccination data here in Michigan. About 25% of kids between 5 and 11 years old are fully vaccinated. That number's a little more than 43% for kids between 12 and 15 years old. And the total number of Michiganders vaccinated hovers around 60%. And here's a quick look at the latest COVID trends. The state is reporting more than 19,000 new cases and 50 deaths. Remember, this data is now being updated once per week on Wednesdays.